ஆடியோ மாத்திவா யாரு?
ஹலோ ஹலோ, பேட்டரி லோட அப்புறமேட்டு பேசுறாங்க. பேட்டரி எடுத்துட்டு போச்சா? கால்ல போடு. அம்மா காது.
Prabhu sir. Prabhu sir.
Yes, ma'am.
Sir, okay, ma'am, okay. Yeah, she joined, ma'am. A very good evening, everyone. It's our pleasure to introduce today's esteemed resource person, Dr. Brinda Teres, who will be sharing their expertise on the topic A. And Dr. Brinda Teres is basically an electronics and communication engineering, completed her master's in applied electronics in 1999 and was awarded PhD under the Faculty of Information and Communication Engineering of Anna University in 2010. She has 27 years of teaching experience from various reputed engineering college and technical universities in India. She is working with the capacity of the professor higher academic grade in sense of VIT Chennai campus for the past 18 years and currently holding the position of Deputy Director of Ranking and IOE for VIT Chennai. She has been with VIT University initially in Vellore for 3 years and then in Chennai for the past 15 years. As the Deputy Director, Ranking and Accreditation, she played a vital role for VIT to achieve the top ranking among private institutions in NIRF in engineering category for 9 years in a row, and VIT to become institution of eminence, QS Shanghai and the rankings, ABET and the NAC accreditation, etc. She acted as NAC coordinator of VIT Chennai for third and fourth cycle of accreditation in VIT. She was the first program manager in the School of Electronics Engineering, VIT Chennai campus, and the division leader for ECE and EEE in 2010. Prior to joining VIT, she was working as the head of the Department of Electronics and Communication Engineering in Valiamme Engineering College, Kattampalattur. She was working as the head of the Department of ECE in St. Xavier Catholic College of Engineering, Nagarkoil, for 6 years during 2002-2006. Her research interest includes optical image processing, optical networking, optical communication, physics of semiconductor devices, and biomedical image processing. 6 research scholars have been awarded PhD under her guidance. As a vivid researcher, she has published more than 60 research papers, 20 book chapters, and 1 patent in these areas in international journals and conferences. She is the life member of ISTE and also the member of Optical Society of America. She is one of the reviewers of IET Image Processing, IEEE Photonics, Academic Radiology, Computers in Biology and Medicine, and many other reputed journals. She has organized a number of workshops, seminars, conferences, and international level symposiums. She is a member of BOS for many universities. She has visited Cambridge University, England, and other countries for academic purpose. Dr. Brinda Teres, ma'am, you are welcome to start the presentation.
Hello. Hello.
Brinda ma'am.
Hello.
Brinda ma'am. Is it okay to share ma'am any issues? No ma'am. Is it audible?
Hello.
Yes ma'am.
Are you able to hear me now?
Good evening, madam. Your voice is
Visible ma'am, visible. Yeah ma'am.
No, madam.
It's not clear, ma'am.
Hello.
Yes ma'am, your voice is not clear ma'am. It's not audible properly.
Mic is there. Alex, start now. Why? Kalian வரமாட்டேங்குது. Hello.
நீங்க இதுல இருந்து ஏதாவது போட முடியுமா? ஒரு நிமிஷம் ma'am. கவர் பாயிண்ட் இருக்கு. அது மொபைல்ல பேசவா? மொபைல்ல ஷேர் பண்றது வருதா? ஷேர் வருதா? ஷேர் இந்த அந்த பிபிடி காணும். பிபிடி எங்க ஷேர் ஆகுது? இது வரலையே. எனக்கு வந்து எனக்கு அது அந்த முதல்ல நான் உங்கள்ட்ட ஷேர் பண்றேன். வரல.
You are muted.
Hello. Hello, screen share ஆயிட்டா ma'am? Hello.
Yes, ma'am. Yes, sir. You can see.
கேக்குதா?
Yes, ma'am. Audible.
இந்த போன்ல இருந்து ஆடியபிள் ஆகுதா? ஹலோ
Ma'am.
Is it audible ma'am?
Yes, ma'am. Kindly share your PPT, ma'am.
I shared the PPT. I shared it the PPT, but it is not coming. Hello. அதுதான் இப்போ ஷேர் ஆகுதா PPT? இப்போ ஷேர் ஆகுதா? அது என்னமோ ஷேர் ஆக மாட்டேங்குதுமா? ஸ்டாப் பண்ணிட்டு திருப்பி பண்றேன். முதல்ல வந்துச்சா? இப்ப இத போட்டு select the window or screen, entire screen கொடுத்துட்டேன். PPT சர்ச் பண்ணா வர மாட்டேங்குது. என்ன
Sir.
அவங்க திருப்பி கால் கட் பண்ணிட்டு திருப்பி ஜாயின் பண்ண சொல்லுங்க.
நான் அதான் மேம்கிட்ட ஜெமிலா மேம்கிட்ட காண்டாக்ட்ல தான் இருக்கேன் சார். சொல்றேன் சார். ஓகே.
மெசேஜ் போட சொல்லுங்க.
ஓகே ஓகே சார்.
நான் பேசுறது கேக்குதா?
மேம் ஆடிபிள் மேம், we can hear. ஆடிபிள் மேம்.
அதுதான் ஆடியபிளா?
Yes ma'am, visible.
கால கட் பண்ணிரட்டவா?
Okay.
Hello.
Yes ma'am, it is visible.
Yes, it is visible. Okay. So good morning, good evening, one and all present here. Thank you for the introduction, ma. So in next 2 hours, we are going to discuss about how the AI is integrated in healthcare and AI integrated VLSI for smart healthcare. Okay. So in order to understand about the integration of AI and healthcare, we should know what is AI. So because in every industry, in everywhere, people are talking about AI. AI is a huge subject. And what is AI? What is AI? We should know. Artificial intelligence refers to the development of a computer system of performing tasks that require human intelligence. AI process large amount of data, and AI identify patterns and making decisions based on the collected information. And to achieve this, AI use machine learning, natural language processing, computer vision, and robotics. AI encompasses a range of capabilities including learning, reasoning, perception, problem solving, data analysis, and language comprehension. So the ultimate goal of AI is to create machine that can emulate capabilities and carry out diverse tasks with enhanced efficiency and precision. So what is artificial intelligence? Artificial intelligence is development of computer system of performing tasks that require human intelligence, and AI process huge amount of data. In AI, the main thing is the data. So in AI, when you are considering AI, we need to consider about the data. the AI model to be properly trained, that means it needs data. Lot of data is required for training the AI model. So in AI,
Ma'am?
கேக்குதா?
கேக்குது ma'am, but slide is not changing ma'am. The same slide. The
Training
first slide
mode
is
வருது இல்லையா?
No, no
அடுத்த
ma'am.
அடுத்த
I can
அடுத்த
see only-
first slide அப்புறம் second slide வந்திருக்கா? Training mode.
No ma'am. No ma'am. We can see only the first slide.
ஐயோ கடவுளே. Stop share பண்ணிட்டு திருப்பி பண்ணவா? இப்போ first slide வந்து second slide வந்திருக்கா?
Yeah ma'am, second slide.
F5 போட்டா வர மாட்டேங்குதுல்ல, அதனால தான் இப்படி போடுறேன். இப்ப வருதா? இப்ப வருதா?
Now we can
இப்போ
see the
வருதா?
second one ma'am. Second slide. Showing the second slide.
Training mode வருதா?
No, training modes on third slide, right ma'am?
Now, one thing I can do like this. Okay, இப்ப போகுதா ஸ்லைடு?
Yes ma'am. Okay.
இந்த மாதிரி வச்சுக்கலாம், சரியா? ஓகே
Okay.
okay. So what is artificial intelligence? Artificial intelligence refers to development of computer system of performing tasks that require human intelligence. So for that, the AI system need large amount of data. So in AI, the main thing is the training of AI model with huge amount of data. So in AI, the crucial thing is the data, AI model training, and the quality of data and quantity of data. Normally, the data scientists consider for AI model training. The quality of data source, volume of data, and diversity of data, they will normally consider for model training. So when you consider AI, the important thing is the huge amount of data we need to consider. And AI is used in many industries. So here I have given some examples where the application of AI and where it is used. Okay. So examples of AI is used. Artificial intelligence has become increasingly integrated into various aspects of our lives, revolutionizing industry and impacting daily routines. And some example, when you are considering, AI is applied in virtual personal assistant system, autonomous vehicle system, healthcare diagnosis and treatment, recommendation system, and fraud detection. So when you consider virtual personal assistant, you can consider the example like Siri, Google Assistant, and Amazon, Alexa normally utilize AI to understand and respond to the user commands. These assistants employ natural language processing and machine learning algorithm to improve their accuracy and provide more personalized responses over time. Next, when you consider autonomous vehicle, AI powers the development of self-driving car, trucks, and drones. So companies like Tesla and Uber are the forefront of this technology, and they are using AI algorithm to analyze sensory data from cameras, radar, and LiDAR to make real-time driving decisions. And when you are considering healthcare diagnosis and treatment, AI algorithms are used to analyze medical data, including patient records, imaging scans, genetic information, to assist healthcare professionals to diagnose disease and planning treatment. So we can consider IBM Watson for health and Google DeepMind are examples for AI platforms employed in healthcare. So when you are considering recommendation system, online platform like Netflix, Amazon, utilize AI to analyze user behavior and preferences. Next, considering fraud detection, AI algorithms are employed by financial institutions to detect fraudulent activity in real time. So these are some of the examples where AI is applied and AI is utilized in many industries. So AI has the potential to revolutionize many industries and fields such as healthcare, finance, transportation, and education, and many industries. So when you consider AI, we need to consider the importance of AI because in today's world, there are huge amount of data in the world we need to consider. Humans are far short of observing, interpreting, and making decision of their entire data. So the complex decision making require higher cognitive skills than human beings. In this case, we need AI. Artificial intelligence is important because higher cognitive skills are required. Another major characteristic that AI machine possesses, but we do not have, is repetitive learning. So this also we need to consider while artificial intelligence. And in artificial intelligence, how artificial intelligence is important to us. Data that is fed into the machine could be a real life incident. How the people interact, behave, and react, that's also important. So the machine learn and think like human by observing and learning from humans. Another important thing is accuracy. Accuracy is another factor in which we humans lack. Machines have extremely high accuracy in the task that they perform. So artificial intelligence is more important in all these fields. So when you consider this, artificial intelligence can be classified into two major categories. Based on the capabilities, we can classify the artificial intelligence as narrow AI, general AI, or super intelligent AI. So when you are considering narrow AI is also called as weak AI. Weak AI refers to artificial intelligence systems that are designed and trained to perform a specific task or narrow range of tasks. And the characteristics of narrow AI include specialized capabilities, limited scope, and lack of consciousness. So narrow AI, specialized capabilities, narrow AI systems are highly specialized and focused on performing specific function or solving a particular problem. They have limited scope. These systems are not capable of generalizing their knowledge or skills to other domains outside their designated task. And their lack of consciousness, narrow AI lack of self-awareness and consciousness. So based on the capability, we can classify the AI as narrow AI. Narrow AI or weak AI refers to artificial intelligence systems that are designed and trained to perform a specific task. When you come to general AI referred to, when you consider general AI, there is no difference between the machine and human being. And the characteristics include human-like cognitive abilities, adaptability, consciousness. So in general AI, system can understand, learn, apply knowledge across various tasks and domains similar to human intelligence. And adaptability is more in general AI. These systems have the ability to generalize their knowledge and skill to new situation, task, and environment. And consciousness. General AI theorized to possess self-awareness. So these are the characteristics of general AI. The next one is super intelligent AI. The super intelligent AI refers to artificial intelligence system that surpass human intelligence in virtually every aspect. So the characteristics of super intelligent AI include cognitive superiority, rapid learning and adoption, ethical existence, existential risk. It can easily handle any type of risk. So the types of AI, when you are considering, we can consider narrow AI, general AI, or super intelligent AI. Based on the capability, we can classify like this. And based on the functionality, the AI can be classified like reactive machine, limited memory machine, theory of mind, and self-awareness. So the reactive machine, these are the most basic type of AI and purely reactive. And the name itself, it suggests it neither can form memories or nor can use past experience to form decision. One example for the reactive memory is IBM's Deep Blue chess playing supercomputer. So the Deep Blue beats the international grandmaster Garry Kasparov in 1997. It can choose the most optimal of the chess moves and beat the opponent. Apart from the rarely used chess-specific rules against repeating the same move 3 times. So this is one example for reactive machine. They neither can form memories or nor use the past experience. They are more reactive. The next type is limited memory. These machines can look into the past, not the ability to predict what happened in the past, but the usage of memory to form decision. And the common example for limited memory is self-driving car. For example, they can observe other cars, speed and direction, and act accordingly. These require monitoring of how car is driven for a specific amount of time, just like how human observe and learn and specifics. Okay. So this is limited memory. Next, a theory of mind. These are the type of machines that can understand that people have beliefs, emotions, expectations, etc. Self-awareness. These type of machines can be called human equivalents. So when you consider theory of mind and self-awareness, the difference is theory of mind and self-awareness. When you consider the differences, the feeling of I want to play is different from the feeling of I know I want to play. So this is the first one is the theory of mind kind of machine, and the second one is self-awareness. So based on the functionality, we can classify the AI as reactive machine, limited memory machine, theory of mind machine, and self-awareness machine. And artificial intelligence uses a wide range of techniques and approaches that enable machines to simulate human-like intelligence and perform tasks that traditionally require human assistance. So AI system work through combination of algorithm, data, and computational power. And what are all the processes involved in artificial intelligence? What are the framework of artificial intelligence? So in artificial intelligence, the process or steps involved in artificial intelligence are data collection, data pre-processing, algorithm selection, model training, model evaluation, model deployment, continuous learning and improvement, inference decision making. All these are the processes involved in AI, artificial intelligence. How an artificial AI work? How does an AI work? So the first process is data collection. As I told, AI system rely on vast amount of data to learn and make decision. Data can be collected from various sources, including sensors, digital devices, databases, internet, and user interaction. And the quantity and quality of data are crucial for training the data accurate and reliable AI model. So the first process in AI is data collection from the sensory data or from a internet or for any data collection, and the quality and quantity also we have to consider. Then second process is data pre-processing. Once the data is collected, it needs to be pre-processed. to ensure it is clean, structured, and suitable for analysis. This is pre-processing stage. In pre-processing stage, the noise removal or handling of missing data, standardized format, and encoding categorical variables. These are all the process involved in data pre-processing. The next process, the third process is algorithm selection. AI algorithms are chosen based on specific task or problem the AI system aims to solve. Different algorithms are suited for different types of tasks such as classification, regression, clustering, pattern recognition, like that. So common AI algorithm include neural networks, decision tree, support vector machine, and K nearest neighbors. And the fourth process is model training. In the training phase, AI model are fed with labeled data or unlabeled data to learn patterns and relationship. During training, the model adjusts its parameter iteratively to minimize error and improve its performance on the given task. This process involves optimization technique like gradient descent and backpropagation in neural network. The next one is model evaluation. After training, the AI model is evaluated using separate validation data to assess its performance and generalization ability. Performance metrics such as accuracy, precision, recall, F1 score, and area under the curve are used to quantify the model effectiveness in making decision, prediction, or decision. The next one is model deployment. Once the AI model meets the desired performance criteria, it can be deployed into production environment to perform real-world tasks. Deployment involves integrating the model into existing systems such as mobile apps, web services, or embedded services. Then the next process is continuous learning and improvement. AI system can adapt and improve over time through continuous learning. For that, techniques like online learning, transfer learning, or reinforcement learning enable AI model to learn from new experience and feedback. Then the last step is inference and decision making. During inference, the trained AI model applies its learned knowledge to make prediction or decision on new unseen data. Inference involves feeding input data into the model and obtaining output prediction or classification based on the model's learned patterns and representation. So, how does AI work? First process is data collection, then pre-process, then algorithm selection, then model training, model evaluation, model deployment, continuous learning, and inference. And these are all the processes involved in AI. So overall, AI system work by leveraging the data, algorithm, computational power to learn from experience, make decision, perform tasks autonomously. So artificial intelligence has wide range of application and has been adopted in many industries to improve efficiency, accuracy, and productivity. And some of the most common uses in industry are healthcare, finance, retail, manufacturing, transportation, education, marketing, in gaming, security, everywhere AI is utilized. And in this, the main important application is healthcare and healthcare. Artificial intelligence for health and healthcare. How computer-based decision procedure under the broad umbrella of artificial intelligence can assist in improving health and healthcare. Advanced statistics and machine learning provide the foundation for AI. Deep neural network can perform well as well as the best human clinicians in well-defined diagnostic tasks. In addition, AI-based tools are already appearing in health-oriented apps that can be employed on handheld network devices such as smartphones. So unlike previous eras of excitement over AI, the potential of AI application in health may make this era different because the confluence of the three main reasons. One, the frustration with legacy medical system, ubiquity of network smart devices in our society, acclamation to convenience and at-home service like those provided through Amazon and others. These are the three main reasons. And when you consider health and healthcare, the three important things we have to consider in diagnosis and treatment is image analysis, predictive analytics, drug discovery and development. So first one is image analysis. AI algorithm can analyze medical images to detect disease, tumor, and other abnormalities with high accuracy and speed. Predictive analysis, AI can analyze patient data, medical history, genetic information, lifestyle factors to predict potential health risks and personalize treatment plans. AI can accelerate the process of finding new drugs and treatment by analyzing vast amount of scientific data and identifying potential drug targets. So these are the field in health and healthcare. Normally we use AI. So first, how AI is transforming medical imaging. AI-powered medical imaging tool revolutionized healthcare by enhancing diagnostic accuracy and efficiency. The advanced system utilizes deep learning algorithm, convolutional neural networks, and computer vision techniques to analyze medical images with unprecedented precision. So because of AI, the radiologists and clinicians benefit from faster image interpretation and reduced workload, enhanced detection of subtle abnormalities, improved consistency in diagnosis across different practitioners. These are all the benefits due to AI. Moreover, AI tools excel in various imaging modalities, including X-ray, CT scan, MRI, and ultrasound, and deep view of diagnostic wound healing prediction. Everywhere AI is utilized. X-ray for bone fracture detection, CT scan for lung module identification, MRI for brain tumor segmentation, ultrasound cardiac function assessment. Everywhere AI is utilized. So the main thing is the improved accuracy and efficiency is the important thing when you consider AI. So AI is utilized in different fields of healthcare. In image analysis, when you are considering image analysis and radiation, radiation is used in cancer treatment, cancer care, and other treatment. Radiation is important. The role of AI in radiation therapy is also very important. So what is radiation? In radiation, actually the use literally energy, high electromagnetic spectrum is utilized in radiation to kill the internal cells of the cancer cell, and also to image. For imaging also, this high energy is utilized, electromagnetic spectrum is utilized, and the role of AI in radiation is very important. So in order to kill the internal cells of the cancer cells, this radiation therapy is utilized. benefits of AI in medical imaging: improved accuracy and precision, enhanced image analysis and interpretation, time efficiency and workflow optimization, data management and analysis. These are the benefits of AI in medical imaging. So first is improved accuracy and precision. Artificial intelligence significantly improve accuracy and precision in medical imaging, transforming the field of enhanced image analysis and interpretation. AI algorithm analyze vast amount of imaging data, detecting minute abnormalities and that might be missed by human eyes. Enhanced image analysis and interpretation. AI provides consistent and detailed analysis of image, reducing diagnostic errors and increasing confidence in clinical decisions. AI tools highlight subtle changes in imaging, aiding in the early detection of disease such as cancer and cardiovascular condition. AI integration supports precision medicine by combining imaging data with patient history and genetic information, creating comprehensive profiles of personalized treatment plans. AI reduces variability among radiologists, ensuring reliable and uniform interpretation across different cases. AI accelerates image processing, enabling quicker diagnosis, treatment planning, ultimately improving patient outcomes. AI algorithm reduce diagnostic and processing time by quickly analyzing vast amount of imaging data, enabling faster and more accurate interpretation. These are the benefits of AI in medical imaging. Another one application of AI, using sound to help researchers to detect tuberculosis in India. So India reports over 2 billion tuberculosis cases. AI model that can flag early sign of tuberculosis through sound, potentially improving diagnosis for over 35 billion people. So this is one application. Then improving access to skin disease information. We could identify skin, hair, and nail condition through computer vision and AI image search capabilities. Researchers concluded that we can identify hundreds of conditions, including more than 80% of the conditions seen in clinic and more than 90% of most commonly searched conditions. AI can be utilized. Another case study. The human eye can reveal sign of underlying disease like anemia, a condition that affects 1.6 billion people worldwide, causing tiredness, weakness, dizziness, and drowsiness. In research published in Nature Biomedical Engineering, we were able to use deep learning to quantify hemoglobin level and detect anemia with identified photographs of back of the eye. So detecting hidden signs of anemia from the eye is possible through AI. Studying how AI can help breast cancer screening in clinical practice. Breast cancer screening helps detect cancer earlier, but diagnosing breast cancer accurately and consistently remains a challenge, with half of all women experiencing false positive over 10-year period. In Nature paper, researchers demonstrated that the potential of our AI model to analyze identified retrospectively collected screening mammograms with similar or better accuracy than clinicians. Detecting signs of disease from external image of the eye. Detecting the signs of disease in external photographs of the eyes via deep learning, published in Nature Biomedical Engineering, shows that a deep learning model can extract potentially useful biomarkers from external eye photos. In particular, for diabetic patient, the model can predict the presence of diabetic retinal disease, elevated HbA1c and elevated blood lipids, biomarker of cardiovascular risk. External eye photos as an imaging modality are particularly interesting because of their use may reduce the need for specialized equipment, opening the door to various avenues for improving the accessibility of health screening. AI in cardiology. AI application in cardiac imaging. AI algorithm improves accuracy of diagnostic condition like coronary artery disease and arrhythmia by detecting minute abnormalities in cardiac images. They assist in interpreting electrocardiogram, MRI, CT scan, providing detailed insight into heart function and structure. AI enables early detection of heart disease by identifying risk factor and early sign in imaging data often before symptoms appear. Predictive analytics powered by AI can forecast disease progression, allowing for timely intervention and personalized treatment plans. AI reduces diagnostic errors and variability, ensuring consistent and reliable interpretation. It streamlines workflow, allowing clinicians to focus on patient care and complex decision making. Another two applications of AI is robotics and surgical assistance. Robotic surgery. Robots can assist surgeons in performing complex procedures with greater precision and minimal invasiveness. Personalized medicine. AI can help doctors tailor treatment to individual patients based on their unique characteristics and needs. So when you consider robotic surgery, using robots in the operating rooms to assist the surgeon in performing surgery. The surgeon views the patient via the terminal and manipulates robotic surgical instrument via a control panel. Views of the organs being worked on are transmitted from tiny cameras inserted into the body. When we talk about robots doing the task of human, we often talk about the future, but robotic surgery is already a reality. Doctors around the world are using sophisticated robots to perform surgical procedures on patients. While robotic surgery systems are still relatively uncommon, several hospitals around the world have brought robotic surgical systems. The first generation robotic surgical robots are already being installed in number of operating rooms around the world. These machines are still require human surgeon to operate them and input instruction. Remote control and voice activation are the methods by which these surgical robots are controlled. Here are the 3 surgical robots that have been recently developed. D1C surgical system, SEUS robotic surgical system, EESOP robotic system. So where the robotic surgery applications, cardiac surgery, gynecology, neurosurgery, orthopedic surgery, pediatrics, radiosurgery, and urology. Here are some of the applications where robotic surgery are. And what are the advantages of robotic surgery? Less scarring, fast recovery time, tiny incision, shorter catheter time, immediate urinary control, significantly shorter return to normal activities, equal cancer cure rate, less post-operative pain. These are all the advantages when we use artificial intelligence here. And in surgery, what are all the advantages? Surgeons have enhanced view, easier to attach nerve endings, surgeon tireless easily, fewer doctors required in operating rooms, in turn cheaper for hospital, smaller risk of infection, less anesthesia required, less loss of blood. These are all the advantages when we use artificial intelligence and robotic surgery. The question disadvantages, question of safety and the cost. The next is AI and personalized medicine. AI plays a revolutionizing personalized medicine. Its impacts on disease detection, diagnosis, and future of healthcare. Individual variation in genetics and lifestyles and environmental significantly impact an individual response to treatment. This realization sparked the emergence of personalized medicine, approach that tailor medical intervention to the unique characteristics of each patient. The shift towards personalized medicine has not only improved patient outcome, but also has led to more patient-centered approach to healthcare. By analyzing individual genetic predispositions, lifestyle choices, and environmental factors, AI algorithm can identify individuals who are at high risk of developing certain diseases. This early identification allows healthcare professionals to implement preventive measures and interventions, reducing the burden of disease and improving overall population health. Another significant advantage of AI integration in personalized medicine is the ability to continuously learn and adapt. AI algorithm can analyze treatment outcomes and patient response in real time, allowing for the refinement and optimization of treatment plans. This iterative process ensures that intervention and constantly improving and evolving, leading to better patient outcome over time. So in AI, personalized medicine is possible by analyzing the individual genetic predisposition, lifestyle choices, and environmental factors. AI algorithm can identify individuals who are at high risk of developing certain disease. But when you consider personalized medicine, utilizing AI, challenges also associated with. So privacy concern, data security, and algorithm bias are some of the issues that need to be addressed to ensure the responsible and ethical use of AI in healthcare. Transparency, accountability, and robust regulatory framework are the essential to mitigate these risks and ensure that AI integration in personalized medicine benefits all individuals. Another application of AI is artificial intelligence in drug delivery and development. AI integrated drug discovery and development has accelerated the growth of pharmaceutical sector, leading to revolutionary changes in the pharma industry. Artificial intelligence has revolutionized many aspects of pharmaceuticals. AI assistance to pharma industry help to improve overall life cycle of the product. AI can be implemented in pharma ranging from drug discovery to product management. So here you see, these are the examples of methods of different domains of AI used in drug discovery and development. So machine learning, decision tree algorithm, random forest, support vector machine, all these domains are used in drug discovery and development. Application of artificial intelligence in different subfields of pharmaceutical industry, from drug discovery to pharmaceutical product management. So application of artificial intelligence in different subfield of pharmaceutical industry, like So role of artificial intelligence in drug discovery. Artificial intelligence can be effectively used in different parts of drug discovery, including drug design, chemical synthesis, drug screening, polypharmacology, and drug discovery. Everywhere, this artificial intelligence can be used. So another important thing we need to consider is wearable technology. AI and wearable technology in healthcare are a perfect match. They are changing how doctors approach treatment planning, diagnosis, and patient care. AI takes the wearable technology to the higher level. So what are the advantages of using AI, artificial intelligence in wearable technology? Predictive analytics, personalization, telehealth integration, cost effectiveness, contextual insights. All these are the advantages of using artificial intelligence in wearable technology, wearable health technology. So predictive analytics, smart watches, fitness trackers, and other wearable measures, vital signs and health metrics. However, they cannot indicate if the user has future risk. An AI health tracker can warn about the risk and send the vitals to the doctor to prevent the situation. Personalization. AI-powered healthcare wearable are strong addition to the personalized patient care. These devices can suggest physical activities or diet to help user achieve their health goals. If the user is already a patient, let's say of diabetes, wearable device can be more beneficial. They can advise on how particular exercise or food is impacting their glucose level. Such adjustment or personalized recommendations improve patient health and give them control over their well-being. Telehealth integration. AI and telehealth are already successful match, and along with wearable technology, it saves time in diagnosis. Patients do not have to take urgent tests, and doctors do not have to rely on the recent research. They can access health condition based on changing metrics over time and real-time data. Even during remote consultation, wearable medical devices help doctors give prescription based on real-time information rather than waiting for the lengthy diagnostics process. Cost effectiveness. Combining AI and wearable technology reduces healthcare costs for patients and healthcare providers. It saves them from some level of investment in expensive machines required for patient monitoring and diagnosis. On the other hand, the patient can manage their health without frequent in-person visit to the hospital and clinics. This way, doctors can prioritize patients with urgent care while managing remote patients virtually. So these are the advantages of using AI in wearable technology. Predictive analytics, personalization, telehealth integration, cost effectiveness, and contextual insight are possible with the AI in wearable technology. Some example for wearable technology. Real AI-powered wearable healthcare wearables. Example, Apple Watch, Galaxy Smart Ring, Aura Ring, and Whoop Strap are some examples of this real-powered AI-powered health wearables. AI in wearable medical devices and fitness trackers brings unavoidable advantage for patient, but it brings some challenges for health tech companies also. So we need to consider the challenges also when we use AI in wearable medical devices. First one is patient confidentiality, FDA approval, data accuracy, interoperability issues, affordability, battery dependency. Patient confidentiality. Health tech companies should focus more on protecting data collected by AI health wearables. Any data breaches that can damage their reputation, discouraging users from purchasing their wearables. FDA approval. AI wearable medical devices must obtain FDA approval, which could be challenging due to strict regulatory standards. Data accuracy. They should train AI model to deliver accurate and reliable user results. Inaccurate result can hinder their treatment plans, health recovery, and future risk. Interoperability issues. AI health wearable must integrate well with hospitals, systems like electronic health records for accurate diagnosis and treatment. So these are the challenges we need to consider while using AI in wearable medical devices. Patient confidentiality, FDA approval, data accuracy, interoperability issues, affordability, and battery dependency. So while considering AI, natural language processing is important. AI can analyze large volume of unstructured medical data to extract valuable insight and improve clinical decision making. Chatbot and virtual assistant. AI-powered chatbot can answer patient questions, provide information, and even schedule appointment, everything. And role of machine learning in medical imaging. Machine learning is providing robust solution for healthcare professionals to improve diagnostic precision and streamline workflow. These advanced algorithms offer powerful tools that significantly enhance the capabilities of traditional imaging techniques. Convolutional neural networks excel in analyzing complex radiological data, enabling rapid detection of subtle abnormalities in X-rays, CT scans, and MRIs. For instance, these algorithms can identify lung noodle in chest radiographs or segment brain tumors in MRI scans with remarkable precision. Support vector machine and random forest are employed for tasks such as classifying breast lesion in mammograms or predicting cardiac events from coronary CT angiography. Deep learning models have shown promise in automating image reconstruction, reducing noise, low-dose CT scan, and generating detailed reports. In other applications of AI, disease outbreak prediction, AI can analyze data to predict and track the spread of infectious disease. Telemedicine, AI can enable remote monitoring, diagnosis of patient, improving access to healthcare in undeserved areas. Artificial intelligence, the advantage is enhanced accuracy, early detection, personalized medicine, efficiency, all these are the advantages of using. And when you are using imaging, the resolution increases with AI. And some examples of AI tools and companies in healthcare. These are the examples. Consultant AI, Metro, Creative, Regard 12, Good Health. as I told, benefits of AI in medicine: improved accuracy and speed, personalized medicine, enhanced patient outcomes, increased efficiency, and reduced cost. So while using AI, we need to consider the challenges in this field. The acceptance of AI application in clinical practice, initially to support diagnostic, the ability to leverage the confluence of personal network devices and AI tools, the availability of quality training data from which to build and maintain AI application in health, executing large-scale data collection to include missing data streams, in building on the success in other domains, creating relevant AI competitions. These are all the challenges in this field we need to consider while using AI. The integration of VLSI in healthcare has opened a new avenue for designing compact, efficient, and reliable medical devices. These devices are critical for application like diagnostic, monitoring, therapy, and even surgical procedures. VLSI technologies enable the development of high-performance chips that meet the stringent requirement of the healthcare industry, such as low power consumption, miniaturization, and high accuracy. VLSI plays a vital role in modern biomedical devices as it facilitates the integration of multiple functions onto a single chip. This reduces the size, power consumption, and cost of device while increasing their reliability. The key areas where VLSI impact healthcare include wearable health monitoring system, implantable medical devices, diagnostic devices, and point-of-care testing. The wearable health monitoring system, VLSI enables the design of compact energy-efficient chips for wearable devices like smartwatches, fitness trackers. These devices continuously monitor parameters such as heart rate, blood pressure, and oxygen level, transmitting data in real time for analysis. Implantable medical devices such as pacemaker and neurostimulator require ultra-power chips that can function reliably for years without frequent maintenance. VLSI ensures chips are highly efficient and robust. Diagnostic devices. Imaging technologies like MRI, CT, and ultrasound rely on advanced VLSI circuit to process high volumes of data quickly and accurately. VLSI-based signal processing improves image quality and diagnostic accuracy. Point-of-care testing. Portable diagnostic devices for blood sugar, cholesterol, infectious disease use VLSI chips to deliver quick and accurate results. These devices are vital for remote health care delivery. Despite the potential designing VLSI for biomedical application poses unique challenges. Low power consumption, miniaturization, reliability and safety noise reduction, advancement driving. These are all the challenges we need to consider when VLSI for biomedical application. And the integration of AI, VLSI technology and AI enhance the ability of healthcare, applicability, efficiency, everything can be increased. The future of VLSI in healthcare is promising with emerging technologies like nanotechnology, 3D ICs, and photonics pushing the boundaries of what biomedical device can achieve. As healthcare increasingly embrace IoT and remote monitoring, VLSI will be instrumental in designing next generation devices that are smarter, more efficient, and more accessible. So, VLSI chips embedded with AI algorithms is revolutionizing healthcare by enabling the design of advanced biomedical devices that are smaller, faster, and more efficient. These innovations are not just improving the quality of care, but are also making healthcare more accessible to people around the globe. As we continue to overcome design challenges and explore new frontiers, the synergy between VLSI, AI, and healthcare promise healthier future for all. So AI integrated VLSI in biomedical devices, enabling the future of healthcare technology. So we have seen the advantages of AI in biomedical devices, how the AI can be integrated. AI in integration of VLSI is important.
Participants, the session is now open for questions. Please feel free to ask your doubts.
Good evening, ma'am. This is Vinu Rajkumar. Hello, can you hear me, ma'am?
Yes, sir. Ma'am, Brinda, ma'am?
Hello?
Brinda, ma'am?
Yes, ma'am, yes.
Yes, ma'am. Okay. Yeah.
Ma'am, this is...
Sir, ma'am, can you turn on your camera, ma'am? Okay, so sir, you can proceed, sir. Vinu, sir.
Yes.
Ma'am, this is Vinu Rajkumar from SRM ISC, ma'am, Ramabura campus. Basically, I am from the Department of Biomedical Engineering. Your session was innovative, and I have a few. I want to make a few suggestions from your side regarding AI-based technology. Is there any feature prediction can be obtained from AI in terms of ECG? Because ECG is it's a kind of life.
It
Hello,
is
ma'am.
possible. Yes, sir. Yes, sir.
What kind of prediction algorithm that can be integrated in terms of ECG so that
Sir,
prediction analysis can be done?
Deep learning algorithm, any artificial neural network algorithm, support vector machine algorithm can be implemented using this to ECG analysis.
Ma'am, basically, I have worked with Armox modeling techniques and regression modeling and all these things. Modeling have been done. Is there any support vector machine algorithm and all these things is okay, ma'am? Is there any other than that SVM like clustering, pattern recognitions, all these things were there? Any other things which is beyond that? If it is there,
based on the literature review only, you can come to a conclusion.
Okay, ma'am. Fine, ma'am. Fine, ma'am.
Because we
Thank
cannot
you,
tell
ma'am.
now.
Okay, ma'am. Thank you, ma'am.
Yes, yes. Any other question?
Participants, any doubt?
Any query?
Yeah, no one having any queries, ma'am, I think so.
Okay. Thank you. Shall I leave?
So on behalf of RF and Communication System Department, we extend our heartfelt gratitude to Dr. Brinda Teres ma'am for sharing your valuable expertise and insights during this FTP, ma'am. Thank you so much for your knowledge sharing, ma'am.
Thank you, ma'am.
Thank you, everyone.
Shall I leave?
Yeah, ma'am, sure.
Ma'am, can you please share that feedback link, ma'am? Please share in WhatsApp group, ma'am, please. It was not shared till.
Participants can complete the feedback and do them.